And we published this in 2024. So essentially the superior limit is the iliac crest. The anterior limit is a line from the anterior superior iliac spine to the level of a horizontal line at the level of the inferior gluteal fold. The inferior limit is the actual inferior gluteal fold, and the lateral buttock is the posterior limit. And we can divide the aesthetic unit into two, an anterior subunit and a posterior subunit. And this is important when you're injecting fat and you don't have a lot of fat. But if we turn this illustration a little bit more anterior and you draw a line all the way to the anterior inferior iliac spine and down, then we expanded the anterior subunit, and this avoids step-up deformities in the anterior view. The second concept, once we have the aesthetic unit defined, then we can divide these areas into zone. Zone 1 superiorly, zone 2 in the middle, and zone 3 inferiorly. And this is important when you executed a procedure. For example, in this case, even though I was able to recreate the lateral curvature, if you look closely, I injected way too much fat in zone 1, giving her a very high hip appearance, which is okay, but it doesn't look as nice. The third concept is defining the different hip shapes. And Dr. Mendieta did this years ago, but when you look at patient in the front view, there's actually other things that we need to consider, other shapes. For example, the hip dip, or the